Greetings from Ayurvedic Foundation. Myself, Dr. Arun. I'm here with the topic Panchakarma, an Ayurveda treatment plan for healthy living. Why this topic we have selected as in current days, we are really in need of cleansing and rejuvenation. Looking into the topic, the primary aim of Ayurveda is Swasthasya, Swasthya Rakshanam and Aturasya Vikara Prasanam. The first line means Swasthasya, Swasthya Rakshanam. The first line, which means keeping the health of or preserving the health of healthy person. And second line means Aturasya Vikara Prasanam. It means curing the disease of diseased person. But the primary aim is prevention, and how this Panchakarma is helping for prevention. And why Ayurveda is having a specialized treatment of Panchakarma? Because the basic principles of Ayurveda is built on three main attributes. It's called as three doshas. The first one is Vata, second one is Pitta, and the third one is Kapha. Vata is basically responsible for all the movements, sensations, and all the body activities, actions, or any changes or any movements or vibrations. And Pitta, the responsible factor for all the chemical changes happening inside the body. And the third factor, which is called as Kapha, and which is basically the substratum, or which gives the body the compactness. And these three are called as Tridosha. And the other factors are Saptadhatu, the seven structural elements which is constituting the body. The seven structural elements are Rasadhatu, Raktadhatu, Mamsadhatu, Medodhatu, Asthidhatu, Majjadhatu, and Shukradhatu. These seven dhatus contributes the structural elements of the body. And the transformation gives the toxins or the waste products, which is called as Trimala, which is three in number, that is Purisha, feces, Mutra, that is urine, and Sweda, that is sweat. These are the three waste products from our body metabolism and transformation. And one of the other major factor is Agni, the capacity to digest and transform. And what happens when a disease is occurring? In every disease occurrence, it is related to the imbalance of dosha, the first three elements, and that is causing due to the disturbance of digestive fire, disturbance of Agni. And once there is a disturbance of Agni, there will be a malformation or improper digestion happens, and that results in production of undigested food, or the essence which is produced from the digestion will not be good to nourish the body. And in Ayurveda, it is called as Ama. And this Ama is capable to create obstructions in the channels. That means the proper nutrition or proper nutrient circulation will not happen inside the body, which results in depletion of the tissues and causes diseases. What are the basic Ayurvedic principles or Ayurvedic principles of treatment? The first, as we have seen in the previous slide, first part of Ayurveda treatment is aimed at prevention of the diseases and how it is attained. Prevention of diseases is attained in two different ways. One is the lifestyle changes, which includes proper diet, exercise, and changes in the lifestyle, and with the biopurification. And prevention of diseases can be attained with two different methodologies. That is, on daily basis, the biopurification which is done on daily basis, and biopurification done on seasonal basis. And another second principle of treatment is breaking the disease process. For that also, we are using biopurification to break the continuity of the disease or occurrence of the disease. Here comes our main topic, it is Panchakarma. So for attaining the biopurification, we are using the technique called Panchakarma. The word Pancha means 5 and Karma means action or treatment. Panchakarma is basically an Ayurvedic therapeutic technique which helps to detoxify the body and strengthen the immune system, thus restoring the balance and well-being. And what is the aim of Panchakarma? Why Panchakarma is needed? When these doshas, Vata, Pitta, Kapha, 3 doshas are imbalanced than a normal limit, because every day there is changes in Vata, Pitta, Kapha. In every hour there is changes in these 3 doshas. But when it crosses the limit, when it vitiates or cross the limit beyond certain level, the same thing becomes toxins to our body. And that causes diseases. That accumulation of these 3 doshas causes diseases, and to clean that, we need a bio-cleansing. If the doshas are variated, or if the dosha variation is within the limit, then we can manage with lifestyle and diet and addition of some oral medications. But when it crosses the limit, you need some purification, which takes out the excess toxins from the channels and cleanse the body. And there comes Panchakarma. And what are the steps of 3 main steps of Panchakarma? Because every procedure have a pre-operative or preparatory procedure or a main procedure, and then comes the post-operative procedure, which these 3 steps are helping the person to cleanse thoroughly and in depth. So for application of Panchakarma, the first step is, or the preparatory procedure is Dipana Pachana. I'll explain in the further slides. Dipana Pachana and Snehana, which is oleation, and Swedana, which is sudation, which gives fermentation. And then comes the Pradhana Karma or the Panchakarma, which is Vamana, Virechana, Vasti, Nasyam, and Raktamoksha. And the Paschat Karma or post-operative procedures are Samsarjana Karma, Upakarmas, Kabbalam, Gandusha, etc. And what is Purva Karma? So before application of Panchakarma, you need to prepare the body. So that procedure is called as Purva Karma. In Purva Karma or the preparatory therapy, we increases or we promotes the strength of Agni, we improves the strength of digestive capacity so that our medicines acts well for purification. And in Dipana Pachana, we use medicines like pepper, ginger, long pepper, and almost all spices are considered as which helps in improving digestive fire. So we use these herbs to increase or balance the digestive capacity. The second step of Purva Karma is Snehana, it is oleation. It is internal and external. The very common word in Ayurveda, which is heard very commonly, is Abhyanga, which is generalized body massage, and administration of ghee or fat internally, it is called as Snehapanam. These 2 are the external and internal oleation therapies, which helps to mobilize the toxins from the different body parts into the central digestive system, which helps to clean. And then comes the Swedana, it is sudation or fermentation therapy, which helps to mobilize the accumulated toxins or accumulated doshas from different corners of body to the circulation. And it helps for vasodilatation, which helps for improving the circulation and nerve conduction. Then comes the Pradhana Karma or Panchakarma. The main 5 procedures, which is Vamana, that is therapeutic emesis. The person will be vomiting with the help of medicines. And then comes Virechana. Virechana is purgation, elimination through the anorectal region. And the third one is Vasti or Basti, which is enema. Fourth one is Nasyam, that is nasal medication. And the fifth one is Rakta Mokshana, bloodletting, taking out blood through different methods. These 5 methods is called as Panchakarma. The first one is Vamana, that is therapeutic emesis, which means induced vomiting with the medicines. So here the main targeted dosha is Kapha dosha, and the upper part of the body is the main target site. But it also helps to clean the Kapha dosha from all over the body. The induced therapeutic vomiting helps to take out the Kapha dosha and clear the channels. And that helps to prevent the disease occurrence by increased or vitiated Kapha dosha. The second procedure is Virechana, that is therapeutic purgation. Virechana is a procedure in which the doshas are moved downwards, and the targeted dosha is Pitta. Pitta is generally a dosha which is having liquid in nature. So it is eliminated through the downward direction, that is anorectal region. So the patient will be induced purgation. And it helps to prevent the diseases which is occurring due to Pitta. The third procedure is Vasti, or which is also called as Basti, and it is enema, which is given through the anorectal region, and the main targeted dosha is Vata. So by giving enema, it takes out the toxins through the anorectal canal in downward direction with a heavy force, which helps to normalize the Vata. So in all diseases which is caused due to Vata, this is one of the major treatment administered for cleansing the Vata. Then comes the fourth procedure called Nasya, which is nasal cleansing. As nostrils are considered as the gateway or the direct offering to brain, this is directly indicated in diseases which is occurring in the head region. It helps to pacify Vata, Pitta, Kapha, but at the same time, it is dependent upon the materials which is used and the method of administration. And very commonly, we are using oil, but in cases of Kapha dosha, we are using some herbal powders. And in case of nasal bleeding and all, this technique is used for this methodology is used. But at the same time, the medicines is fresh herbal juices. And Nasya helps to clean the upper part of the body, especially in the head region, which is considered as the seat of all sense organs. So Nasya is having a major role in cleansing the sense organs. The last or the fifth one is Rakta Mokshana. The word Mokshana means letting it out and to relieve, or it is means as a relief. So taking out blood or relieving blood is called as Rakta Mokshana. Diseases related to blood. And these are one of the these are two common methods which is shown here. The first one is Rakta Mokshana using leech, and the other method is called as Rakta Mokshana using a syringe or a needle, and which is directly puncturing the vein. And the post-operative procedure in Panchakarma is, these are some of the examples. Dhumapana, which is smoke inhalation. Kabala is gargling and to clean the mouth, and smoke inhalation to clean the channels related to nostrils. And the main post-operative procedure is Samsarjanakrama, or following a strict diet pattern. So these are this is one of the common diet pattern which is followed after the cleansing. First one is kanji or rice gruel, which is very thin and easy to digest. And basically it's a carbohydrate based diet. And then comes to the protein based diet, that is moong dal. Soup of moong dal is used here. And this is mainly for the protein supplement. And next comes the meat soup or meat soup with the ghee we are using. This is to supplement the fat. And the common benefits of Panchakarma: eliminates the toxins. Panchakarma helps to eliminate the toxins from the body, and it restores balanced metabolism, and it balances the three doshas. As we have learned that three doshas and its variation is causing the disease. So Panchakarma helps to balance the three doshas, and it helps to manage or cure the disease, and it enhances the mental clarity. When there is a disease in body, definitely the mind also gets affected with that. So Panchakarma helps to clean the body, and that will help to clear the mind. And Panchakarma reduces the stress. When you have a mental stress or physical stress, if you perform the Panchakarma in its proper method, it will help to reduce the stress in body and mind. And it helps to slow the aging process. Because when there is a imbalanced metabolism, when there is a lot of toxins in the body, then aging happens quickly. By doing Panchakarma, you can take out the toxins and metabolic waste from the body, which helps to slow down the aging process. And it improves the tone, texture, and glow of skin. It boosts immunity, strength, energy, and vitality. And it is mainly used as rejuvenation or revitalization therapy, because when you take out the toxins from the body, it helps for cells to multiply properly and to repair properly. So Panchakarma procedures are basically the preparation procedure for rejuvenation therapy and revitalization therapy. It helps to clean the cellular cells, and it makes the cells to absorb better nutrition. And Panchakarma in Dinacharya. Dinacharya is the daily regimen advised by Ayurveda. And Panchakarma is a part of this daily regimen. It helps for prevention of diseases and clean the body on daily basis. In every stage of food transformation, digestion, metabolism, and transformation, different types of waste are produced in the body. And the main transformed waste is feces. And next comes urine, that is a watery waste. And the third waste, which is quantitatively minimal, is called a sweat. So this is after the effect of food transformation and metabolism. And this waste, when it is accumulated in the body, it causes disease. So the Dinacharya, that is the daily regimen, is aimed in cleaning these waste on regular basis. So Dinacharya mentions what all the things you have to do to protect your body from the diseases and on a daily basis. That's why for cleansing, Panchakarma method or Upakarmas, associate procedures, also included in daily regimen. These are some of the Panchakarma techniques or Upakarma techniques, procedures, which is part of daily cleansing. The first one is Nasyam, that is nasal drops, which helps to clean the nostrils and rejuvenate the sense of smell. So Nasyam is included as a part of daily regimen to clean the nostrils and sense of smell. Kavalam, that is gargling, which comes under an Upakarma, and it helps to clean the oral cavity, as well as it helps to strengthen the teeth and gum. And next comes the Dhumapana, that is medicated smoking. It helps to clean the nasal and of course the lungs, and which helps to prevent the diseases occurring due to Kapha dosha. Next comes the Anjanam, that is application of collyrium. And it helps to clean the eyes on a daily basis. Daily application of collyrium or Anjana is advised to clean the eyes on a regular basis. The eyes are considered as the highest used sense organs or high privilege sense organs. So cleaning that on a daily basis is very important. That's why Anjana is mentioned for cleaning the eyes. Next comes Abhingam, that is oil massage, which helps to improve the circulation, which helps to alleviate the body. See, whenever we are in action, we are in movements, there is a chances of wear and tear in the body joints, as well as due to excessive utilization of the joints. Those who are doing a lot of climbing, walking and all, there is a possibility of dryness in the joints. So Abhyangam helps, that is oil massage helps to reduce that dryness in the body, as well as it helps for the easy movement of the joint. Then comes the Uddharta, that is powder massage, which helps to clean the skin as well as open the sweat pores, which takes out the excess sweat from the body and which helps to have a better tone, texture and color of skin. These all procedures is for safeguarding the body from the diseases. Next comes Ritu Shodhana, that is seasonal cleansing. Panchakarma is mentioned in Ritucharya, that is in seasonal regimen. Seasonal regimen is basically the lifestyle and diet which we have to follow in each season. Each season is having its own impact in your body. For example, when it is very cold, the dosha balance in the body is different compared to when it is hot. Summer to winter, that changes will happen inside the body. For preventing diseases due to this variation in the environment, certain regimen is mentioned by Ayurveda, which is called as Ritucharya. And as a part of Ritucharya, Ritu Shodhana, that is purification, also mentioned by Ayurveda. Accumulation of doshas from which is happening in Shishira, that is winter, should be expelled out during the next season, that is spring or Asanta. The doshas which is arising from Grishma, that is summer season, should be expelled during the next season, that is called as rainy season. Doshas that is arising from Varsha should be expelled during Sharad, the next season. So here comes a seasonal cleansing which helps to prevention of diseases. These are some of the research evidences which is available in international journals, which helps you to understand what is the effect of Panchakarma. In the first case, the first paper, it is Virechana Karma is used to balance the triglyceride level. Nowadays, one of the common condition, the lipids and triglyceride levels are very high in people due to sedentary lifestyle, and Virechana helps for reducing the triglyceride level, and Vasti also helps in effective reducing in the cholesterol level. So this is a comparative study. Both treatments are seen effective, and this helps you to understand how Ayurveda is effectively using this Panchakarma treatments in cleaning the body. The second paper, traditional Ayurveda along with yoga therapy reduces symptoms, intensity of pain, and improves the quality of life in migraine. This is one of the common diseases nowadays seen in people, those who are working in IT sector, or those are exposed to sunlight a lot. So Ayurveda treatments helps to reduce the intensity of migraine, and it cleanses the channels of upper part on the head region, which helps to dilate the veins and arteries in the head region, which helps to reduce and cure the migraine. The next study, here Vamana therapy, that is emesis therapy, is used in the management of depressive disorder. And depression is one of the common ailments nowadays, and Vamana helps a lot in managing the depression. In the next study, you can see Nasya is used in case of cervical spondylosis. Those who are using computer a lot, those who are especially in IT field, they are very commonly suffering with cervical spondylosis due to damage of the cartilages and defective spine. So Nasya is helping to restore the spinal health and prevent the occurrence of cervical spondylosis. This is the next study, which is done on the changes happening in the metabolism. So here, Panchakarma based Ayurveda intervention is used in healthy subjects, healthy people, to know what are the changes happening in the metabolic profiles. The last study, which is Shirodhara, that is continuous pouring of oil on the head, which is used for improving memory and sleep quality. This is one of our clinical experiences in AVPR specialty clinics. This is a case of spider poison. A female patient was affected with a spider poison. You can see the skin lesions and the swelling on the leg. And this is treated with the help of Virejana, the purgation therapy. This was the first presentation. And after treatment, after doing the Virejana therapy, the lesions has reduced and the patient got relieved from the symptoms. This is another case where a diabetic foot ulcer is treated with Rektamoshna, that is bloodletting therapy. You can see a putrefied wound. This is after the second picture is after cleansing. The outer skin is removed. Compared to first picture, you can see there are changes in the second picture. First picture, the wound, a putrefied wound, which is very smelly, very bad odor, and a lot of exudates, that is, first discharge was there. That wound was cleansed, and the borders are more clear now. And here we have used the Rektamoshna technique using leeches. We have used multiple leeches here that helps to for better granulation, better growth of the muscle tissues, and which helps to close the wound. And the result is like this. So we have started from this wound, and with the Rektamoshna therapy, we are able to treat the wound and heal the patient. And what is the importance of Panchakarma in present era? Why we have selected this topic today? Was in current era, the present time, we are having a high exposure to toxins in daily life. Some or the other way, we are taking toxins inside the body. Very common thing is food preservatives, additives, hastening agents, artificial coloring substances, and use of pesticides, chemical fertilizers, and exposure to polluted water, air, and environment. Nowadays, you know that we are highly exposed to polluted air and water. And use of these chemical fertilizers and pesticides destroys the quality of food. And all these toxins, unknowingly, it is going to our body. And next common factor is work-induced stress and strain. When there is excessive stress, it will not allow you to perform well. Most common stress is from work. And to de-stress, to take out the stress, Panchakarma helps. And due to improper food habits like untimed food, junk food intake, excessive calorie intake, insufficient quantity of food, and malnutrition, we are suffering with different diseases. And Panchakarma is one of the main solutions to clean the body and helps to take out the toxins which is consumed through the food, and it helps you to reduce the stress and strain, and which helps you to have a better digestive capacity, assimilation, and metabolism. So Panchakarma is one of the major cleansing program which helps you to have a healthy living. And Ayurveda offers this Panchakarma treatment for various diseases and for rejuvenation purpose. So Panchakarma helps you to have a healthy life. And at AVPRO Specialty Clinics, we have all the facilities for doing the Panchakarma cleansing therapy for all disease conditions. Thank you all. Thank you for listening. Greetings from AVPRO Specialty.